Hello. Thumbs up, can you hear me okay? Thank you. I'd like to begin by acknowledging the traditional owners of the unceded lands we're meeting on today. It's the land of the Wurundjeri people of the Kulin Nation, and pay my respects to elders past and to those present today. I really enjoyed the welcome to country, the really generous welcome to country by Mandy Nicholson at the beginning of this summit. And she talked about First Nations people being the first doctors here. And I think that also very much applies to the first researchers, the first knowledge gatherers and wisdom gatherers and sharers. So really wanted to acknowledge that long, long history of First Nations people in the research space. So I will introduce myself. Let me get the little clicker very quickly because I hate that photo of myself. So my name's Chris Cooney. I'm Executive Manager, Policy Strategy and Impact here at Vic Health. So I oversee our research investments as a sort of part of my portfolio. Full disclosure, I am not a researcher. I'm not from academia. I'm not even from a public health background. I've spent kind of about 3 decades now working in the corporate sector up until the time I joined Vic Health about 2.5 years ago, but have become very, I would say, very invested in the role of research and the difference that it does make, but also the potential that it has, I think, to do more and to be more impactful into the future. So really looking forward to this discussion today. So just a little bit more on the topic. So what's the role of research in a post-truth world? So post-truth was the Oxford Dictionary Word of the Year in 2016. And it's been defined as when objective facts are less influential in shaping public opinion than appeals to emotion and personal belief. Post-truth has been said to have a decisive impact on the biggest political issues of our day, from the election of Donald Trump to Brexit and the scientific debates over the greatest existential threats of our time, climate change, and of course COVID. Also, if you really want to keep it brief, it's more commonly known as the first cousin to fake news. So the session today is going to explore the challenge faced by the research community to respond and maintain impact in a post-truth society. The need for relatable and translational research is greater than ever in this post-truth era. Combined with a decline in public trust of institutions and anti-science movements fueled by climate skeptics and responses to the COVID-19 pandemic. So what do we need to do differently as researchers and as media to influence policy, politics and public opinion in the post-truth society that we find ourselves in? So fairly big topic for a kind of lunchtime session. So we've got a fantastic panel here today. I'm going to introduce them one by one and we're going to hear their kind of initial thoughts on the topic, and then we're going to have quite a lot of, hopefully, audience participation and interaction. So I will start on my left here with Professor Teo Yek Ying, more commonly known as YY, and so I will be calling him YY from this point forward. YY is the Vice President for Global Health and concurrently the Dean of the Saw Swee Hock School of Public Health at the National University of Singapore. YY majored in statistical genetics, having completed his doctoral training at the University of Oxford after completing his Masters in Applied Statistics in Oxford and a Bachelor in Mathematics at Imperial College. Prior to the deanship, he served as the Director for the Centre for Infectious Disease Epidemiology and Research, and also as the Founding Director for the Centre of Health Services and Policy Research. So YY, we're just going to hear from you, obviously a really strong background in research and in public health, to get your initial take on this topic about the role of research.
Thanks very much, Chris. So I've always been of the opinion that research at the end of the day must be useful for guiding policies and programs. But regrettably, in our current world, where university rankings seems to dominate the attention of most presidents and VCs of universities, there's this worry that research these days is just going to remain as publications, and then with that, people get more grants, and then get more papers, and then get more grants, and it's a vicious cycle that doesn't see any impact or translation at all. And it's from a different session, but I will actually make the comment that from a perspective of decolonizing global health, we should really think about decolonizing university rankings. But I'll just leave it as that. But before I come to the meat of the issue, could I just have a raise of hands? How many of you would consider yourself to be a scientist, an academic, a technologist working in public health or global health? Please raise your hands. So many of you are here are part of that community that I talk about. And if I could just take yourself back to 2020 when COVID-19 happened. And some of you would be very fortunate, like perhaps myself, to be based in a country where policy making, you have leaders with the humility to accept that they need guidance from public health scientists, from medical doctors, or people who knows what they're doing, rather than politicians themselves with political agenda. But at the same time, there will be many politicians or policymakers around the world that were fumbling when it comes to trying to mount a COVID response. If you come from a country with that particular setting where your policymakers are fumbling, I would perhaps ask you to think about what was going through your mind at that point in time. Were you just wringing your hands in frustration, or were you actually thinking that, oh, I could actually help to provide some guidance because I do mathematical modeling, I'm able to provide some guidance on the use of PPE, on how much vaccination is going to help, and so on. So that's how I see the role of academia or research, actually, to really help to correct some of the policy thinking, to provide guidance on the policy thinking, and also to help to correct some of the misinformation and disinformation that Chris will talk about. Because oftentimes I belong to a number of WhatsApp group that was circulating a lot of information during the COVID-19, including a family group, which was telling me things like, oh, drinking hot water is going to help reduce your risk, taking this particular pill is going to help. And the question is, do we actually make an effort to correct that, to say that we have the local science, we have the data to help to address some of this? And I see this to be the important aspect of research, particularly in this day and age where people resort to social media, resort to TikTok to get their news, but not really the official traditional news. But of course, having said that, at the same time, you have world leaders around the world that was propagating misinformation and disinformation, and that's where you need the science to be loud enough to counter some of this political agenda. And I see that it is not also as simple. It is not just telling you now that you need to make a difference. Go speak to your policymakers and make a difference. Try to contribute to policies around vaping, around climate action. But are there even platforms that are established to enable that level of interactions between the policymakers and yourself? And I see, again, coming back to some of the university leaders or leaders, managers, CEOs that are in the audience, to challenge you to actively think about creating those platforms to facilitate those interactions. Because in this post-truth world that Chris you talk about, I really do see the importance of those platforms being established to help to guide evidence, guide action around climate, which I believe Nick is probably going to talk about, around issues of vaping, increasing antimicrobial resistance, or even simply the role of the importance of certain vaccines. Vaccines, we keep talking about the inequity about COVID-19 vaccines, but the reality is that inequity around vaccines have always existed before COVID-19 came about. And it was just not publicized in a big way. If you just think about the human papillomavirus vaccine, the HPV vaccine, there has always been that inequity. And I see that this is the role where local scientists, local academics, working with a global partnership is able to first drive action on the ground and secondly, mobilize international funding to fund some of this. So I'll just stop there. Back to you, Chris.
Thanks, Wai. And we will get lots of times for questions and interactions, but we're going to go through the panel first. So I'm going to introduce you to the next panellist, Professor Nick Watts. So, what was so funny there? Did I? Professor Watts is the Director of the Centre for Sustainable Medicine, National University Singapore, where he leads their efforts to accelerate the transition to net zero and resilient healthcare systems across the world. Prior to NUS, he's worked as the Chief Sustainability Officer for the NHS in the UK, where he spearheaded their efforts to deliver low-carbon healthcare, leading the greener NHS team with a budget of almost $1 billion. He's a medical doctor, a Fellow of the Royal College of Physicians, Faculty of Public Health, and has worked as the Executive Director of the Lancet Countdown, and as founder of the Global Climate and Health Alliance and the UK Health Alliance on Climate Change. Whew. So Nick, as a medical doctor, and then someone who's worked in the climate space and the sustainability space for sort of well over a decade now, I imagine you've encountered a fair bit of scepticism in your time. Interested in your views on the topic today, on the role of research in this world.
So I might not talk, if it's okay, from the perspective of a researcher or an academic. I might talk from the perspective of the NHS. 5-6 years ago, there was no such thing as a zero-emission ambulance. No one had kind of got around to it, and Elon Musk wasn't very interested. Ambulances are complex, they're heavy, they have to move sort of fast, they have to be able to accelerate, they have to carry a bunch of weird gases, they have to be able to go up and down to help patients and staff get in and out. They do weird things, and so the basic engineering of them is not that complex, but it's just like one step more complex than figuring out a electric van for Coles to deliver groceries. So the NHS thought, well, we could probably do that. We're quite a large purchaser of these things, and so we set up a series of innovation competitions. We had electric vehicles. They could go about 120 miles. That was more than enough to cover our urban centres. We developed a couple with some hydrogen range extenders, giving them another 200 miles, which the United Kingdom has a very different concept of rurality to Australia. So 200 miles was more than enough to reach our rural populations, operating on a 24-hour cycle. We were pretty excited about this, right? They were actually cheaper. The air pollution was less. You didn't have them idling outside the front of hospitals, or if they were idling outside the front of hospitals when they were ramped, they were charging, so they were doing something, useful. The Daily Telegraph disagreed. They thought they were a bad idea, and we started to get a couple of early questions from a few different parts of the Telegraph, and then their friends the Mail started to send through a few more questions. Then we started to get a bunch of freedom of information requests, and that's sort of fine because our team was equipped to be able to manage those sorts of things. Then some of the ambulance trusts across the country started to get those questions as well. Eventually, there was a front page story, and then another one, and then another one, talking about the fact that these electric ambulances were not as fast as the diesel counterparts. And so as a result, obviously, we were killing all of the patients in the NHS because our electric ambulances, we were prioritising polar bears over, kids with asthma or whatever. And so maybe to talk about the response to that. Step one, obviously, read the damn story properly and check, is that right? Is there actually a problem here? Now, our electric ambulances can go 111 miles an hour. Our diesel ambulances can go 117 miles an hour. So yeah, sure, technically, they do go a little bit slower. But anyone that has been a paramedic or a nurse or a clinician inside an ambulance, or frankly been inside an ambulance at all, knows that you don't want an ambulance to be going over 100 miles an hour. That would be insane, especially not in Birmingham or Manchester or frankly anywhere in the United Kingdom. So we actually ignored it to begin with, but it started to gain steam, and interestingly, it started to gain the attempt at a little bit of legal action from someone that didn't like us very much. I started to get some fun invites to show up on a regular radio program with Reform UK, which is the sort of successor of the UK Independence Party, Nigel Farage's party. Then Nigel started sort of calling us out, set up a little bit of a parliamentary inquiry around the thing. The NHS is not very good at defending itself. We're a pretty defenceless organisation. Government agencies often are pretty defenceless when this sort of stuff comes up. And so we had to turn to our friends in academia. to defend ourselves. We had to think firstly, what's our role? Our role in this was to shore up the science of this within the sort of stakeholders that mattered to us, the chief financial officer, the chief medical officer, Treasury, number 10. We did that by bringing into a series of private briefings some of the experts that from University College London, from Imperial, from Oxford, that had helped us with the initial setup of this work. Having that independent, private, serious and sensible conversation helped turn number 10 around and say, okay, fine. We can see that there's not actually a problem here. Number 2, facts matter in the United Kingdom, believe it or not, more often than not. And there's a regulator of the media Ofcom. Almost all of those stories had to be retracted because the academics had done some of that work and had actually gone and checked and done a study for 12 months on a pretty huge sample of our ambulances. Not a single ambulance in 12 months in the United Kingdom had gone over 92 miles an hour. So it was entirely irrelevant. But they'd done that work, and they'd done that work quietly, and they were able to turn around to Ofcom and say, listen, this is clearly erroneous. We need to start to print some retractions here, and Ofcom agreed. Then they had the facts that they were able to take and hand over to the real sort of powerful spokespeople, the presidents of the Royal College of Paramedics, and the Royal College of Emergency Medicine, and some of the people that were actually a part of some of these ambulance development programs said, actually, do you know what? They're pretty great. Patients kind of love them. There's a whole bunch of new innovations here. They deliver care digitally. They have great links back to the hospital. We're able to actually avoid quite a lot of our patients having to come in. And so suddenly we started to move onto the offensive. Finally, some of that science being able to turn around is what helped us bat off pretty quickly with the NHS's chief counsel, some of the legal. I don't think it was ever really going to progress to a lawsuit, but it made us confident that if it did, we would enjoy that fight, and we might actually want that fight to be public. So people backed off. But I just to reflect for 5 more seconds on what was happening there were a group of damn impressive, damn intelligent, damn committed academics who had done the work and done it well before the challenge came. And they'd done that really pretty deep policy relevant stuff, and they'd done it in partnership with us as we were developing the programs out. When we came under attack and we said, hey, we could use a little bit of help, they said, how's 9:30 a.m.? They didn't say, how's May, how's June? They didn't say, let me wait for the publication cycle, let me apply for a grant first, and then They were ready and they were moving on the timescale that was important, because that story was evolving in a matter of minutes, not in a matter of months. And then I think critically, and this is where we fall down a little bit, they didn't get any citations for this. They didn't get any real accolades at all. In fact, I haven't told you their names because they would rather their names weren't sort of put out, because they get a few attacks around this kind of stuff. But they were doing this stuff because it was important. They were behaving almost in every possible way, collaborating pretty damn closely, maybe you could argue too closely, with government on some of this stuff, in every possible way, like an academic doesn't. But undoubtedly, because of the stuff that they did, 78,000 tonnes of carbon every single year have been taken out of the atmosphere because they were there to defend an otherwise pretty damn defenceless NHS.
Thank you, Nick. That was great. Our next panellist is Fron Jackson-Webb. So Fron is the Conversation's Deputy Editor and leads the site's health coverage. Fron was one of the Conversation's founding editors, launching the site in March 2011, and was later its Chief of Staff. Fron previously managed the Australian Medical Association's Victorian Media Office and worked for BBC magazines in London. Fron is proud of her Aboriginal heritage and lives on Dja Dja Wurrung country in central Victoria. Welcome, Fron.
Thank you.
So you are the media representative here on the panel today. So just interested in hearing your thoughts on this topic, what you see as the role of media in reporting the truth and the role research can play in helping you do that.
Thank you. And thank you, Nick, for telling that story of how media works at its worst. I want to approach this question by taking you back to 2011 and telling you a bit about the Conversation, the organisation that I work for, why and how we were established, and what we've learned along the way. So back in 2011, our founder, Andrew Jaspin, looked around the news media in Melbourne and Australia and saw that there was all of this untapped knowledge in universities, in research institutes. We had academics who had a lot to say, a lot of knowledge, but they'd been burned by media. You know, they'd been taken out of context, they'd been misquoted, they'd been reduced to a soundbite when talking about really complicated research and, you know, solutions to really complicated issues. So you had masses and masses of real experts out there who didn't want to talk to the media, and so their research, their messages weren't getting out to the public. So our mission was to act as a bridge between the two. So what we wanted to do was get that expertise and give it directly to readers. So we set up the conversation, which doesn't have paywalls, it doesn't accept advertising, it's free to republish, so any other news organisation can, you know, grab our stuff and rip it off. They've just got to attribute the expert and their organisation. So this all came at a time, of course, when newsrooms around the country and around the world were being hollowed out. So previously, newspapers got their revenue from selling classified advertising. So all of the, you know, car sales, the real estate. When that all went online, they missed a big opportunity to monetise that. And so they had to look to other ways to try to fund journalism, which is pretty expensive. So we were really dealing with a news media that had fewer journalists. You know, a lot of journalists were being made redundant. The journalists that remained were being asked to do more with less. They had to produce more stories each day, and they didn't have, you know, the decades of expertise that those redundant journalists had. So that's how we started. That was 13 years ago, and so much has changed, but what hasn't is our mission, and that is to correct misinformation and to get that great knowledge that has previously been untapped in universities and research institutes out to the general public. So the rise of social media, I think we have to talk about that when talking about research and mis and disinformation and the media. That's meant that media organisations no longer control the message. It's been both good and bad for all of us, I think, in this room. But what it has meant is that readers are increasingly just existing within their bubbles. They're not going outside for, you know, alternate points of view, for, you know, different perspectives, for new information. And I think that, I mean, you've just got to open a newspaper or turn on the radio in the last week to see how harmful that can be. You know, today, the last couple of days, we've been talking about, you know, how we can strengthen regulation on our social media platforms like X. You know, should people be able to view horrible images of, you know, a stabbing? We've also seen, you know, the generative AI, another big threat to good information, and deep fakes. We've seen Dr. Carl, you know, selling dodgy pills because now we can just get generative AI to create someone who looks like a famous person or someone we know and trust, to feed disinformation to make money. So we've tried a couple of things along the way that didn't work. Comments is one of them. What ended up happening, and we've got a few conversation authors in the room. Hi Dan, hi Anna, hi
Hands
everyone
up.
else. The comments were appalling because they really were just transplanting what we saw on social media, all that toxicity, onto the comment section of our articles. Sometimes it helped having experts and, you know, academic grown-ups in the room to get people back on track, but, you know, we tried that, it didn't work. I think that the big thing that we've learnt along the way is that we really need to meet people where they are. And that means using, the simple language that people understand. It means telling stories about misinformation and where it originated. How did this rumour come to be? What is it based on? We don't judge people for believing in it, because sometimes it might be a plausible explanation. It might be something that, science is yet to test. So, I might leave it there for now. Just to say that I think that the main thing that we've learnt over the years is that when people are backed into a corner, they won't engage. So we've really had to work out how we can engage with readers, how we can tell stories and deliver evidence in that slightly gentler approach than ramming it down their throats.
Thanks, Ron. I think Wawa wants to
Actually,
have a discussion.
I would like to speak up for the media a little bit, which is kind of surprising.
Thank you.
Because I come from a country where we still value the role of responsible media in actually guiding health literacy within the country. And I do think that responsible media, it's integral to any effective policy making. But of course, we should also recognize that there's country cultural context, because I come from a country where we are able to monitor and regulate our media, but equally, Nick comes from a country where your tabloids are fantastic, fascinating. I spent 11 years in the UK, and it's always very interesting to see the kind of news that they can make up. I mean, the latest around Kate Middleton, that in itself, it's saying something. But I actually come back to the point about how media, scientists, policymakers work together can make a difference in the success or failure of a policy. And I talk about COVID-19 vaccination. In Singapore, we actually rely on traditional media, and our politicians use social media to correct some of the myths, disinformation, misinformation that was circulating on WhatsApp. And because we monitor it, the government, we meaning the academics, monitor this fake news. The government have agencies to monitor the fake news as well. We were able to track what are some of the prevailing views of the population around believing the fake news, so that the government or the academics, the public health experts can come in and tackle some of this fake news directly. When people start thinking that, wow, there is a certain billionaire in the world that is planting microchips in mRNA vaccines, we were able to address some of it. There were claims that mRNA vaccines have a higher rate of deaths causing cardiac arrest. Again, we were able to come up with the evidence to support that. So, and the scientists would actually need a platform, and that's where I come back to responsible media. And of course, right now, the question is how much of the media that's around the world. I like to think Australia still has very good responsible media outlets, but it's not every country that's like Singapore or Brunei. You just look at what's happening in the UK or even the United States, and you can see that there is a worry that responsible media is becoming rarer and rarer. And that's not even going into the bit of the social media where we're unable to regulate as effectively.
Yeah. Thank you, YY and Fron. And I think Australia's got a mix of responsible and irresponsible media, but we'll talk more about that. We're going to finish off kind of the official part of it with Dr. Caroline Wallace. So Caroline's the Manager of Research and Impact at Vic Health. She's a Fellow of the Australasian College of Health Service Management, an experienced leader in health and community services, and has an industry-based PhD on community connectors. Caroline's just going to do kind of a brief summary and observations, but as she does that, I'm going to flick to the last slide so you can scan the Slido while she's talking. Not that it won't be interesting while she's talking, but and think about some of the questions you'd like for the panel. We're going to largely use Slido, but we might, if we've got some old-fashioned hands up, we will do that as well. So over to you, Caroline.
Thanks, Chris. It's good to see a few phones up, and I'm sure some of you are better than me at multitasking, so you can listen and write questions at the same time. It was really fun to have the opportunity to pull this panel together, to bring together people with different experiences and perspectives. And, you know, as our session was titled, "What's the role of research in a post-truth world?" Well, first of all, we're all saying there is a role for research. It's loud and clear. It's how you navigate that, and it's who you work with. So obviously, YY just drawing out we're needing the science to be loud enough, and so you use that term platform several times, and it's something I think we all want to probably discuss a bit more in this room, is how we build those platforms and who's useful to have on those platforms and how big can they be perhaps. And then, Nick, the example of having the research, but you really brought in that notion of relationships, and obviously having worked very closely with researchers to be ready to come up with those quite amazing ambulances. And then, of course, when it all goes a bit pear-shaped, to be able to call quickly on those relationships and have that strong backing, like the cavalry just came in, so that strong, sensible, useful, proactive, innovative public policy wasn't derailed. And I think I've been burned by media in so many ways, and not as just certainly less as an academic than is just a leader in public and community services. And so it can make us cautious, and that's why I think an initiative like the Conversation is such a great, and you did use that word, bridge between, you know, the people with the knowledge and the people that can benefit from it. And obviously that notion of engaging stories and relationships, they are part of the elements, I think, that we need when we build our strong platforms. So I just briefly want to talk a little bit about Vic Health's role in research. So it's lovely looking out at lots of familiar faces and some new faces as well. There's people here who know Vic Health quite well. As a health promotion foundation, we've just initiated our new 10-year strategy focusing on systems transformation. It's very ambitious, looking at transforming neighbourhood and built systems, commercial and economic systems, and food systems. So our research role in that is producing research that is not lofty. It needs to be accessible. It is community and researcher-led, and I can see some of our partners here who work so beautifully with a lot of the community groups and organisations. Some of our work is quite macro, but some is extremely grassroots and participatory and action research, and that's where you sort of bust through those post-truth barriers, because you're working with people who actually can vouch for and need and want and value the research that we're creating together. So then they help us not only in undertaking the research, but disseminating and keeping it living and active and part of what they do. A big bonus that we talked about the platform. Vic Health is super fortunate, and I can see our policy and government relations manager sitting in the audience. I can see a fair chunk of our social marketing and comms team, which are the most amazing social marketing comms team I've ever worked with. And from the diversity of skills, Vic Health has made a deliberate decision to invest, because research alone sitting there isn't useful. We need to get it out. We need to have people with the digital skills, people who can do the storytelling, people who are driving us right at the start when we're setting up our grants. Carolyn, what's the story here? Why are you doing this? What's the change you want to see? Can you articulate it? Can people grab hold of this? And finally, as we're developing our impact strategy, our research and impact strategy to sit alongside the larger strategy I referred to, we're really quite deliberately moving to be what we call third generation researchers. I didn't make that up. That's coming from a fantastic report I really commend to you put out through RMIT called Research Impact as Ethos. And I think that's something I think all of us as researchers are striving to hold on to, the sort of first generation of research where you're really seeking relevance. You're seeking the relevance of the academic world. That's your publications, that's your citations, and they have value. Moving then into the second generation, where you're reaching into a new world, where you're trying to get more legitimacy, value, and literacy. And But where we're wanting to go now is to really be that third generation of research organisation. We're really seeking transformational change that's in line with our strategy. We want to be purposeful, connected and adaptive. And I think that focus on research is what really will help us be grounded in truth, in multiple ways of understanding, using information that's meaningful and relevant and accessible to people. So I'll hand back to Chris to bounce some questions around and then hand to the audience.
Thanks, Carolyn. Is that working? Yep. Thank you. We've got lots of questions coming through. Fron, I might start with one for you around the media's responsibility in reporting the truth in these days of sort of clickbait and profits and readership. You know, what responsibility does the media have?
I think a massive responsibility to get it right. I mean, I wish that all media had, the high standards of the best health and science journalists we see in this country. I think that overall they do a fantastic job at the conversation. Fact-checking is just something that we do every day. We always have it. In order for one of our authors to make a claim, we need to be able to back it up. So usually that means we need to check peer-reviewed, published research evidence to make sure that it can be supported. Unfortunately, in the media landscape, you have commentators who aren't experts, who don't rely on evidence-based information, who, throw numbers and claims around without the evidence to support it. So I think that it is the number one thing that the news media needs to do. Some do it well, but unfortunately not all.
Thanks, Fron. Nick, a question for you. Thanks for reminding us of the importance of timely and relevant research. One challenge is finding research funding for more of that pragmatic research. Any thoughts or advice on that?
I don't know a huge amount about the Australian environment. Why I erroneously said that I was British. I'm Australian.
No, you were talking about British anyway.
I don't know a huge amount about the Australian environment, but it is an enormous problem. I really, spent 5-6 years working in the hardest at a British bureaucracy. I don't think, and I apologise, but I don't think ever once did I ever once look at a peer-reviewed paper on anything we were ever doing. Usually because they weren't asking questions that were relevant to the stuff that we were asking, or if they were, they weren't moving fast enough, or they weren't applied to the right context. We would go out and have all sorts of conversations out with sort of different parts of the clinical, scientific, sort of academic communities. But one of the core problems was we probably never asked a question that had a half-life of longer than like maybe absolute max Friday sort of thing, because it needed an answer by Friday, or it needed a decision by Friday, and a decision to not do something was a decision and the opportunity would pass you by. So you had to say A, B, or sorry, come back in a few years. And so when we would turn around to some of the people and say, hey, could you help us out? And they say, yep, great, we'll do a systematic review. We'll come back to you in about 6 months and we'll give you sort of, the early draft of what we found, and then we'll publish it. And then once we've published it, then you can read what we've written. I'm not giving an answer. One of the things that we did try, the UK has these academic health science networks that are funded by the NHS. So they're not funded by NIHR or the MRC. They're funded by the NHS to bring academics into different networks within the NHS precisely for that. So we actually pay for academics' time, not to give us peer-reviewed sort of literature and go and conduct their own extensive studies, but to do really sort of rapid 48-hour turnaround synthesis. We've set up one of those for net zero healthcare in the UK, but we're hoping to set up a couple more. That's the closest thing I can find to an answer there.
Yeah. Thanks, Nick. A great question here from Mo, and probably more so in the Australian context. I might direct it to you, Fron or Carolyn. But, did we need to do a better job of translating research that demonstrated the value of an Indigenous voice at the last referendum? Do you want to have a go, Fron? Or you?
Yes. Oh, okay. Where to start with that? I think it was really difficult for Mob in the lead up to the referendum to, I don't know, get out there and separate how you're personally feeling with, you know, your community responsibility, what everybody else expects of you. The people who did, you know, it took a really heavy toll on everyone, and, you know, it's still being felt, and there are people who still aren't ready to go back out there. So I think yes, but, you know, it's really difficult because people with, you know, the expertise to talk about how the referendum would actually impact Aboriginal people, you know, they're pretty few and far between. So, you know, everybody wants a piece of them, but also, you know, they're copping a lot of flack from all sides. So ideally, yes, but it's difficult, and, you know, it's a lot of pressure.
Yeah. Thanks, Fron. A question here about why the public has lost trust in government advice. Now, might be a little bit different in Singapore, but I think kind of what we saw, you know, particularly during the pandemic, was really that lack of trust in government advice that's continued. So why do you think that has been happening globally?
I suspect, well, you're right to say that in Singapore, the general public still trust the government quite a bit. And I believe this is true for quite a number of the Southeast Asian countries. And there's still, and including East Asian countries, there's a degree of trust that we see between the community and the governments that we don't generally replicate in Western countries and Western cultures. But why is that? And to a large extent, it is also to do with what is happening in the political system in countries, where if the people start to see that politicians are making claims or making statements that ultimately has a political agenda, that's where you lose trust very quickly. And I come back to the bit about peacetime versus crisis time. If you're not able to build trust during the peacetime, I would say that in reference to COVID-19, that was a crisis time. So right now, where we believe that we've gotten the best of COVID, it is a relatively peaceful time from an infectious disease outbreak epidemic perspective. But if you're not able to build that trust with the people, between the scientists and the policymakers during peacetime, it is going to be very difficult to try and expect during crisis time that people will be listening to you, and it is much more likely that they would think that whatever you say has a political agenda behind it as well. So, and coming back to the question around what Nick was saying, that you managed to have that platform where hospitals were financing academics. That is a form of building trust as well. Because I was asking Nick after he made his intervention, was that interaction between the hospitals or NHS and the scientists already present before they had this problem with the ambulance? And Nick said yes. And that meant that they already have a culture of engaging the science to inform some of the decisions that they have. And that culture is very important, because if you don't have that opportunity, when the crisis around the ambulance happened, Nick, probably you and your team would be scrambling to find who would be able to help advise this. And there was this question around how do we fund and build those platforms? Would academic institutions be expected to fund? This is a business decision from the customers. And the customers here would be the hospitals, NHS, MOH, Big Health. Perhaps that's where you need the evidence base. And how do you actually dangle carrots to attract scientists, academics to come to your team to say, we may need inputs within a 48-hour frame, but we are happy to pay you a retainer such that you're always on guard to help us, and you're always ready. And I see that to be exactly the platform that Caroline talked about, that it's very important for us to think about how do we enable those platforms to be developed and funded, because you can't expect universities to constantly fund those platforms indefinitely. So if agencies such as NHS, Big Health, Ministries of Health require those advice, the question is how do you have a form of a retainer platform that is built as part of engaging scientists to guide policy making in a very short span of time.
Thanks, Wai. Fron, one for you. How can we do better to provide training to researchers to communicate their work clearly and to engage with media to amplify the impact of their research?
Oh, that's a good question. I think that improved media literacy needs to start in schools, and I think that we are seeing some of that already. I know that, we often shake our head at what the next generation has to deal with, but I actually think that the media and science literacy of teenagers today, it's actually really impressive, and I have a lot of hope. So I think that, it starts with better education for children. And what was the other part of the question?
It's deleted it from me.
Oh.
The support that academics need to be able to really
Yeah.
get their message out there through media in a really punchy and cut through kind of way.
Yep. Okay. I think that, not to plug the conversation, and I'm sorry that I keep doing this, let me just tell you a bit about how we do it. We let academics and researchers kind of dip their toe in the water a bit. So we really work with them to... They write the article, and we as professional journalists and editors work with them to create something that is kind of accessible and interesting to a lay audience. But we always, we put it back to them and we ask questions, we probe, and we get something in the end that is, kind of like a collaboration with the academics byline. It's their work. But it really allows the academic to get a sense of, responding to the devil's advocate, to, work out what thorny issues might come up in follow-up media. So when they go out after their conversation article is published or their research is published and they're doing, radio interviews, TV interviews, they've thought about those thorny questions, their responses to it, and how they can, neatly summarise what they do. I think that media teams in universities are an untapped resource. So they often have, sessions where they will work with a group or individuals to, sharpen your messages, to work with you if you've got research coming out, to promote it, to, be frank with you and say, actually, people don't know any of that, so go back to basics, go back to really simple messages, and, to kind of hone your message, to work up from the basics so that, your research can be clearly communicated to a lay audience.
I'll just very quickly add a point. I'm of the opinion that actually professors, scientists, and academics need media training. And if you belong to any of those group, I challenge you to please go to your university administrator and say, could I have media training so I can communicate my science better to a lay audience? And you would not realize how powerful that message is, because most scientists actually have a problem when it comes to translating their findings to a lay audience and to communicate that message very well. So we realize that, and I make all of my professors go through media training right now. And we don't just get the university's media or comms to do it. We actually engage professional media within the country to come into the university and train the professors. How do you stand in front of a camera and speak? How do you summarize your message in layman languages?
Fantastic advice. Well, the doors have been opened, the bell is ringing. I was told to stick to 1:50 strictly. We have the public session, so there's going to be lots more people coming in. So do make sure you catch it, misinformationitis. But a huge thank you to our panel today. Loads and loads of questions. And thanks for all the questions. Sorry we didn't get to them all.